This is Dr. Jerry Hesch, a physical therapist at Hesch Institute in Aurora, Colorado. And this is my client Sylvia. And she came to see me from Virginia. And she had a twisting injury a couple of years back. And in response to that has pain in the abdominal area, pain in the anterior thigh, knee pain and foot pain, pain on the outside of the pelvis, and pain that wraps around the abdominal, lower trunk abdominal area. And the purpose of this video is to demonstrate what's really rare is to find blocked mobility of a rib going superiorly. And that's called, in the osteopathic literature, that's called a bucket handle rib dysfunction. And so it behaves as though the rib got pushed inferiorly because I can move all of the ribs inferiorly towards her hip, and there's good mobility. When I reverse the direction, and we're covering rib 7 and down, if I push up, I'm on rib number 7, give or take one rib. I can't be exactly precise. And then I come down and I'm on the lateral aspect of her body, lateral aspect of her trunk, and I can induce easy superior mobility. And as I come lower, I start to feel a little bit of resistance, especially here. I can take up the slack, pushing it with a moderate amount of force to a stop point. And then I try and push it further and it doesn't move. So I cannot glide that rib, which is probably rib number 7 or 8, could be 9, does not move superiorly. And if I come beneath that, this should be rib number 9 because I'm at the very bottom of that costal margin, and 9 moves up. So the treatment is to capture rib, what I believe to be rib number 8 and rib number 7 together, and I'm going to push both of those up towards her shoulder. And it's there's about a 20-degree angle in my arm, which is just based on her anatomy. That's I'm leaning against her pelvis when I do this vertical glide. And I simply keep a vertical force and hold that for about 2 minutes. And that should increase superior bucket handle mobility of the rib. After that, we retest it, and if it's mobile, then we teach her to do left side bending trunk stretches. So in sitting, she'll bend to the left side and reach overhead with her right arm and stretch. And I'll get that in film in just a moment. We also tested medial glide of the rib and lateral glide. And we treated an upper rib restoring medial glide at what I believe was rib number 4. And we tested all of the ribs for medial glide and lateral glide with her laying on her stomach. Now I've had that for a little while now, so I'm testing superior spring now. And I'm coming up just a ½ an inch, and she has good mobility there. Good mobility there. I'm going to walk down again. And I'm almost at the very bottom. I am at the bottom, and all of those now move. So we have improved superior movement of the rib. And let's have you sit up, and I'll show you the exercise I want you to do, okay?
Okay.
So sit up and face the window. So, for about 3 weeks, every single day, I want you to do this trunk stretch. And what you do is you lift your right hand up and over your head. Beautiful. So it's like you're trying to touch your right ear.
Okay.
And you bend all the way to the left. Beautiful.
Yes.
Beautiful. Excellent. So you're reaching up overhead, stretching over to the right, and I want you to maintain this stretch for 2 minutes.
Okay.
Okay? And then after you've kept the stretch for 2 minutes, then I want you to try and increase the stretch a little bit by bending your elbow, just slightly. Just really, yeah, lean on your hand. Beautiful. Lean on your left hand and just do 30 little side bend stretches.
Okay.
Got it?
Got it.
Okay? And while you do this, do it slowly, and I want you to image moving your breath into these ribs. Image this part of your rib cage expanding and moving upward.
Okay.
Okay? So let's have you step down now and move around. Take a walk. Move your arms around, move your trunk around, see how you feel. So walk down to the end of the hall and back. This has been a frustrating injury. She hasn't been able to get any benefit with seeing multiple practitioners, including manipulative therapists. And she's had a diagnostic workup. They worked up her liver, had a lumbar MRI, and none of that had any positive findings. So we're treating it from a mechanical perspective. And yesterday we treated her sacroiliac joint, found her right SI joint to be hypermobile, and we applied the sacroiliac belt down low at the level of the trochanters, and she feels more stable when she's standing, and when she's walking she feels her balance is better, and even laying down in bed, if she takes the belt off, she feels an increase in discomfort. So for unknown reasons, she developed hypermobility in the right SI joint, and the SI belt will be used for about 3 months. So come on back and tell us how you feel. Your thoughts?
I feel better, and right here is little sore,
Uh-huh.
but I can feel little difference. It's like when I used to walk before, I felt something get in.
Uh-huh.
It's like something bother me inside.
Okay.
But it's sore, but it's not the same feeling.
Okay. So how much is the pain decreased by? What number would you have rated it 20 minutes ago
Okay.
on a 10-point scale?
I don't know how to say. Maybe it's a half pain.
Maybe it's cut in half. The pain is cut in half?
Yes.
Okay. Well, good. That's
Yeah, but
encouraging.
When I came, it's just got a pain right here.
Uh-huh.
It start to disappear a little bit.
That's less.
Just less.
Good.
Yes. Yeah, it's weird.
Interesting.
Yes.
So I
It's like
think
that's something got problem on the hips, but it's on the rib.
apparently there's some contribution.
Yeah.
So it's a great example of needing to evaluate the whole body.
Yeah.
I was surprised at the rib being restricted.
Mm-hmm.
I was surprised to find the rib higher up restricted, number 4 as well.
Yeah, because when I came here, when I touch here, it's
Yeah.
bothering me. But
Uh-huh.
I touch now, it doesn't bother me the same.
Wonderful. Well, you know, the front of the rib, in front of the spinal column, connects to the sympathetic chain.
Yeah, okay.
So the sympathetic part of your nervous system has a direct linkage to the front of the ribs. So inside the body, next to the spine, these are part of the rib joints where the rib hits the vertebrae or hits vertebrae and disc, and along that, on both sides, is the sympathetic chain. And there are nociceptors within the sympathetic nervous system and within the things that it innervates.
Yeah.
And
Okay.
so there is
explanation.
there is a mechanical explanation. Yes.
Yeah. Yeah. Because nobody can find the explanation why when I walk I got the pain right here on the liver. Everybody thought it was the liver,
Uh-huh.
but it wasn't the liver this time. Actually, I got X-ray
Yes?
what it show on the rib,
Yeah?
it got less. What is saying? It lose bone. They say they don't
is
receive
that
enough.
right?
Yes.
Really?
The doctors say it was. The doctors say it don't get enough oxygen. I start to lose my grip, and I say, what is the explanation for
Reduction
that?
in calcium?
Yes.
Okay.
And that was weird. That's what he told me. They said your rib doesn't look the same as the other ones.
Interesting.
I don't know why.
Interesting. I'd love to read that report.
Yeah, I will send it to you. I got that report over there in Virginia, but
Yeah.
I forgot to bring.
Very good. Well, so this rib pattern that we just demonstrated is called a bucket handle rib dysfunction. And you'll find that writings on that in the manual therapy literature, in the osteopathic manual medicine literature as well. And I don't see that very often, so I'm happy to have this opportunity to film and show the treatment. And
When I used to do this stretching,
yep.
I feel so good.
Okay.
But I didn't understand why.
Oh, is that right?
Yes.
Very good.
I now can't find it. But I didn't do very much.
Uh-huh.
Because I always thought it was my hips.
True. Yes, yeah.
My ribs. I was on the wrong spot.
Very good. Well, thank you. You're going to help others learn about this.
Yeah, maybe somebody got twisted like me.
Yeah.
And got to paint all this, and they can find explanation for it.
So with your permission, I'll put it on YouTube.
Yeah, that's fine.
Very good.
All right.
And do you want your face in, or do you want us to blur it out?
It doesn't matter.
Okay, we'll keep your face. People like to see the face of the person
Okay, yeah.
in the videos, but some people want privacy, so we always ask.
Mm-hmm. That's fine.
Good. Well, I'll send you a link when I post it.
Okay.
Thank you so much.
You're welcome.